Mental professionals, what is the worst mental condition that you know of? Capgras syndrome, the belief that the people around you have been replaced with imposters. This one is absolutely hell for everyone involved. I'm a nurse, and I had to care for a large man who had coder delusion. He was admitted with some unusual behavior that got worse and turned into full coder delusion. This condition makes you believe you're actually dead. He would scream that he was dead all day and night, living in constant fear. He was such a kind person, but over time he became so exhausted and terrified that he became dangerous and ended up punching a nurse in the face. Reply: I also experienced this after I nearly died during an extremely traumatic event. Honestly, I was mentally messed up afterward, but at its worst, I would call my mom in the middle of the night, hysterical, begging her to promise me that my baby daughter and I weren't dead. I'm doing much better now than I used to be, but I still have occasional times in my life when it comes back, and I get this feeling like we're not actually alive and our reality isn't real. It's really scary. I have a friend who works with seriously disturbed patients, and she told me about a woman who habitually drank hand sanitizer. Apparently, when you do that, your joints lock up and you have to be immediately rushed to the ER for treatment. And what do they have in the ER every 10 feet or so? Yeah, more hand sanitizer. So this woman had to be restrained, otherwise they would find her in the hallway, pumping it directly into her mouth all over again. Delusional parasitosis comes to mind with this prompt. I've watched a patient visit over a dozen doctors, trying to get someone to confirm that she's infested with parasites. After countless stool samples, blood work, lab tests, scans, biopsies, and more, it's clear she doesn't have any parasites, but she remains completely convinced she does. Reply: a friend of my mom's developed something like this after getting into the wrong kinds of drugs. She was convinced that there were tiny bugs living in her face. Absolutely convinced. She would pick at her face constantly, day and night. She picked the skin off her face bit by bit until it looked horrific. She got sober for a little while, came back to reality, and stopped picking at her face. But the damage was already done. Her entire face was covered in scars. Outside of thought disorders like schizophrenia, scrupulosity OCD is pretty brutal. Basically, it's an obsessive fixation on going to hell, and the person is convinced they're going there no matter what they do. At its worst, it's all they can think about and talk about, preventing them from focusing on work and family. Knowing they'll burn in eternal torment one day slowly drives them insane. I don't work in mental health care, but I work in hospice. The worst case of dementia I ever encountered was a woman who had kept her childhood trauma hidden from her children. When she developed dementia, her only remaining memories were of the abuse. She spent her days screaming, crying, and trying to break out of her room, leaving her fingers bloody from the attempts. It was absolutely horrific for her family, the staff, and her husband. It's the worst thing I've ever witnessed. Reply: that can actually happen? Holy shit. I just hope I die of something else before dementia has a chance to get me. I have so much trauma that I can't deal with anymore. I just push it down and pretend it isn't there. Medication has helped a little bit, but therapy did absolutely nothing for me. Though I'm not a medical professional, during my brief time working in an outpatient facility, I met a patient with body integrity identity disorder, BIID. He was convinced that his arm didn't belong to him and consistently described it as feeling like a stranger's limb attached to his body. His overwhelming desire to have his arm removed pushed him into a severe depressive episode, which ended with him attempting to mutilate himself, ultimately requiring amputation. After the surgery, he said he finally felt at peace. However, I left that job, so I don't know how the surgery affected his mental state long-term. Body integrity identity disorder is still a relatively unknown identity disorder without many treatment options available. SSRI is usually prescribed to help with depressive symptoms, but it doesn't always seem to work. Going through something like that just seems like a terrible experience. Dealing with those obsessive thoughts constantly. That has to seriously mess with your mind. Paranoid schizophrenia is no joke. I had a patient who was so convinced that aliens were watching his life through his eye that he tore it out with his bare hand. And he didn't even regret doing it. Some of the rarer dementias. There's one that literally turns a perfectly normal person into a psychopath. All their other mental abilities stay intact. There are dementias that literally destroy your brain and don't even have official names. There are rare familial types of dementia so specific to certain families that they don't have names but could develop really early, and again, you know it's headed your way. And then there's Huntington's, which you likely know you're going to get and have already watched your loved ones go through. The embedded hallucinations in Lewy body dementia can go either way, very distressing or strangely comforting. With the non-organic illnesses, it's a toss-up between treatment-resistant psychosis and severe, emotionally unstable personality disorder for the worst impact on quality of life. Clinical depression. Sitting in a room with someone and you can feel the emptiness surrounding them. It's like a complete void. I worked with someone who accidentally set their bed on fire while smoking and just sat there watching it, like they were watching daytime TV. Zero emotion and zero reaction to move away from it. It's absolutely chilling. Huntington's disease. I'm a master's student and my research work focuses on HD. It combines the symptoms of Alzheimer's, schizophrenia, and Parkinson's all together. Although it only affects 1 in 10,000 people, it's a genetic disorder where if even one of your parents has the mutated gene, you definitely have a 100% chance of getting it. People have gone to extreme lengths, including sterilizing themselves to stop passing down the gene. It's a progressive disease that only gets worse over time. It starts with muscle twitching, then involuntary movements, inability to speak, and finally complete muscle paralysis. The symptoms worsen as time goes on. In fact, it gets so unbearable at the end that the only relief is death itself. Life expectancy is a maximum of 30 years after diagnosis. I trained in mental health care, but ended up working in a different field. Manipulative personality traits. They aren't really diagnosable. They can potentially be treated, but paying for treatment is a nightmare because it's hard to get a proper diagnosis. Manipulative personality disorder isn't recognized in the DSM-5, but borderline personality disorder is. However, borderline doesn't cover actively manipulating family members and children so that an adult can gain an advantage. Manipulative personalities and behaviors create family environments that are hostile and abusive. But nothing can be done until actual abuse occurs. It's a gray area, which is why I think it's so difficult. My wife, a therapist, had a client with FND, functional neurological disorder. This means they had the symptoms of a neurological condition, in this case seizures, but there was nothing physically wrong with their brain. In my opinion, it's one of the worst conditions because you're basically told it's all in your head and there's nothing we can do about it. There's very little information about how to treat it, and doctors don't take it as seriously as a neurological condition that appears on a brain scan. Occupational therapist, so more focused on physical rehab, but let me say Huntington's is one that really stands out. It affects your thinking, your behavior, and has devastating physical effects. Awful, absolutely terrible. It is entirely genetic, and the fact that it strikes you in your 30s to 40s is especially heartbreaking. Not a professional, but in my opinion, PTSD is one of the worst. My dad is a Desert Storm combat veteran, and he is messed up. He went undiagnosed and untreated throughout my entire childhood, and he was straight up abusive, physically, mentally, verbally, all of it. He became extremely suicidal in my later teen years and became extremely violent toward people in public, and we finally had to force him into therapy or an inpatient program. He's doing well now, no longer an abusive jerk, but damn did it ruin some lives. Anything that comes with unshakable paranoia, schizophrenias, certain forms of dementia. People are terrified all the time with no way out. Attempts to calm their many worries usually get sucked into a spiral of delusions and transformed into another reason to be afraid. Also disturbing, a symptom of severe alcohol damage is seeing insects crawling around. In the milder version, on surfaces around the room. In the worse version, they're crawling under the skin. No pink elephants or white mice, but rather cockroaches, spiders, or maggots. Again, logical conversations do nothing to fix it if people are even still able to follow a conversation at all at that point. I have a mental illness, and living with it is horrible. If you ask me, they're all horrible for the person living with them. Wanting not to be alive, but knowing you cannot inflict the pain and suffering on family members. Knowing that you being here and your family members supporting you is still causing them pain is hard to deal with. Holding down a job and being a productive human is completely time-consuming and exhausting. I'm grateful to be alive and have the support. I understand I will have to be medicated for the rest of my life. Not a condition exactly, and I bet there are worse things. But appearing to others or being perceived by others as more mentally handicapped than you actually are. Imagine being treated like a small child at all times no matter what you say or do. Your whole life and all family connections have long since stopped visiting. It's isolation even when you're around social people. All the time, forever. I had a patient who had regressed to an infant-like state. And through talking with them and working with them, I got them toilet trained, doing their daily living activities, participating in activities, expressing themselves, eating independently, and dancing. They got discharged back to their residence, where they were treated like a severely handicapped person. Within 3 weeks, they had regressed back to the infant-like state. 3 months of progress gone in 3 weeks. Be kind to people for no other reason. I'm a psych nurse in a psych hospital in Canada. I work in a state mental hospital, and it's been my experience that any mental illness is horrible. It kind of depends on the severity, but as far as damage done, cluster B personality disorders can absolutely destroy people. Not just the people who suffer from them, but their families and anyone close to them. Borderline and narcissistic personality disorders destroy anyone close to them. And personality disorders cannot be treated with medication. So while something like schizophrenia is a horrible condition, generally it can be controlled with meds. The personality disorders require long and extensive therapy that most people aren't willing to do. Maybe a basic answer, but as a therapist, severe OCD is the worst I've encountered in real life working in a clinical setting. It's completely indiscriminate about who it affects and has absolutely ruined the lives of some really brilliant and wonderful people that I've worked with. It's also more difficult to treat than you'd expect. Medications and therapy are pretty effective for many of the more severe and chronic mental illnesses, but OCD can be particularly resistant to any intervention and causes such intense distress. Not at all trying to diminish the impact and difficulty of any other illness, but personally I think the more severe cases of OCD are terrifying. Not a medical professional, but schizophrenia. My brother is schizophrenic and became a completely different person within a year. He's been hospitalized so many times because he refuses to take medications, believing they are cursed. He almost died in a car accident because he drove off the highway thinking demons were following him. He hears voices that cause him to do rituals and speak to himself 1,000 miles a minute. He genuinely believes nothing is wrong with him, and that is the scariest part. Any condition with serious delusion is terrifying. A lot of them have been mentioned here, though I can't really pick any as the absolute worst. Even mild dissociation can be quite frightening. So, as delusions become more severe, it can get so dangerous and terrifying for everyone involved. If I had to pick one that I think would be the worst for me personally, probably Capgras, since I already have some intense anxiety about losing people. And the concept of Capgras is both constantly feeling like you can't find people you care about while also being around who you think are total strangers. The toughest part about any delusional condition is they are so hard to treat. We don't have a ton of pharmaceutical treatments for them. The therapy itself can only manage symptoms, not reduce them. And often the patients themselves are so lost in the delusion they don't commit to treatment. I can only talk about what I've seen in my experience working at a college counseling center. So not the worst condition in the world, just difficult ones I dread working with that are beyond the scope of care we can provide. It would have to be eating disorders. A colleague consulted about a student with severe anorexia who is still in heavy denial about their condition. They have extremely low body weight, won't engage with our treatment, and won't seek the care they seriously need off campus. They still exercise constantly to drive their body weight down further. They only came to us because their athletic coach won't let them participate, so they wanted us to clear them to play. I feel a lot of helplessness. We only have the capacity to do brief therapy at our center. Eating disorders are beyond that scope of care, especially the ones that require long-term intensive care, close monitoring by medical professionals and dietitians, especially when their insight and motivation to seek treatment is extremely low. The idea of them suffering through the day on campus makes me so worried and sad. Huntington's disease is the saddest one to see. Though patients usually don't stay under mental health care since there's really not much that can be done aside from supportive and environmental care, then you have to tell the family that everyone's going to get it. As for hardest to manage, that would be eating disorders. On average, I'd say these are worse than any other category, highest mortality rate too, I believe. That said, regardless of condition, the worst part is hearing some of the backstories of how the patient's mental health got to this point. A tie between borderline personality disorder, where they self-destruct and sabotage their own life, usually leading to feelings of abandonment and later to progressively worsening self-harming behaviors. There's a reason why in some European countries, if you're diagnosed with BPD and go through testing and screening, you can elect to euthanize yourself due to the harm you can cause yourself and others with the self-destructive behaviors. The second would be paranoid schizophrenia. Like others have posted, it's like rolling a natural one in life and being sent straight to hell. Very few cases where someone manages to maintain their medication regimen and live with some normalcy. Extremely high suicide and homelessness rates. Some of the worst and best patients I have ever had the pleasure of getting to know. I'm a case manager in the mental health field. All of them. You feel trapped in your own body and mind. Every mental diagnosis affects each person differently. Every case is different, but they all usually start with a really messed up childhood. Sexual abuse starting as an infant, being forced to eat their own feces to have something to eat, being forced as a child to have sex with strangers so their parents can get drugs, being starved and beaten almost to death by the people who are supposed to protect you, being locked in cages for weeks. How this job has not broken me, I don't know, but I know I have to keep going for them, so they have some stability and someone they can count on every day. Don't get into the mental health field for money. It's not there. You work all day, every day, but to have someone who has been through the worst imaginable hell know you will answer their call seriously makes it worth it. Don't get into this field if you can't set healthy boundaries where you can easily do a no-call, no-show to end your job. People with mental illnesses who receive care depend on you. Walking away from them makes them relive that trauma all over again. Apologies, as this might be inappropriate to the question, and I can't remember the exact name of what I'm describing. I recently heard of a symptom or syndrome where the victim has the extreme feeling of needing to crawl out of their own skin all over their body. What struck me about it is that pretty much every person and story I heard about suffers of this said they either tried or successfully ended their own lives because they couldn't tolerate the feeling for any length of time. The survivors, I recall, pretty much universally said they had to be sedated, restrained, or forced not to take their lives, and they have severe PTSD from the experience. The thing that got me is how acute it is. Other things can be a slow and horrible decline into death, but something that can make anybody want to die instead of living through it, and it's all in the mind, there was specifically no physical presentation, is terrifying to me. If anyone can point me toward the name of the symptom or disease, please let me know. bipolar schizoaffective disorder. Even worse, when you've already had kids by the time you have your first break. I'm terrified my children are time bombs waiting to have their lives similarly destroyed as mine were. On top of the guilt, I'm scared my condition affects my ability to effectively parent with kindness and compassion consistently. It's hell to live second-guessing literally every interaction, hoping that whatever you did was normal. I'm also 100% convinced some elements of mental illness are made worse by how your parents raised you. I lived my whole life terrified of my mom, who would just fly off the handle about the tiniest of things. Example, family playing Monopoly on Thanksgiving. She realizes she's going to lose, and she flips the board. She had the mental maturity of a 9-year-old. So I never felt safe communicating with my parents about anything, and it forced all my dialogue internal. I'm fairly certain that's where my anxious thoughts and PTSD started, and I think the brain changes based on thought patterns. Yes, genetics play a role, but I think those are just odds, and they get further stacked for or against you based on how you were or weren't nurtured. I'm not a therapist, but I have done a couple of stays in a psych ward. I have diagnosed borderline personality disorder, among other things as well. But during my last stay in the hospital, I was told by multiple people, including a patient with schizophrenia, that I have the worst thing possible. My brain is hell, and the awful part is it's a disorder that's developed from ongoing, continued childhood trauma. My brain cannot process a gray area. There's a 50% suicide rate for people with BPD. Half of us take our own lives. I've been told constantly I'm a villain by people here on Reddit and by my own family. But thankfully, there's a form of therapy for us called dialectical behavioral therapy that was developed by a person with BPD. And it works so well. I can regulate my emotions most of the time, but progress is not linear. I constantly remind myself that 2 steps forward, 1 step back is still 1 step forward. I'm growing day by day. As someone who lives with dissociative identity disorder, DID, it is one of the worst. Dissociative identity disorder is a mental health condition. If you're living with DID, it means you have 2 or more separate identities. These personalities control your behavior at different times. Each identity has its own personal history, traits, likes, and dislikes. DID can lead to gaps in memory and hallucinations, believing something is real when it isn't. Dissociative identity disorder used to be called multiple personality disorder or split personality disorder. DID is one of several dissociative disorders. These disorders affect your ability to connect with reality. Huntington's chorea, inherited, incurable neurodegenerative disease. It starts in 30 to 50-year-olds with problems with mood. Then it progresses with jerky movements, psychiatric disorders, and dementia. Death occurs 15 to 20 years after diagnosis. The patients I've seen have alienated their support system in the early phases and need care on a locked ward 24/7. They lived in terror, had hallucinations and delusions, and attacked caregivers. Their children had a 50 to 50 chance of developing the disease. I have BPD and it sucks. It affects every aspect of life. It's like having a couple of symptoms from every disorder. Self-hatred and body dysmorphia, binge eating and sometimes not eating at all, self-harm, suicidal intrusive thoughts, and several suicide attempts a year. Then intrusive thoughts more like OCD, thoughts about harming other people, which have caused me to lock myself in the bathroom and call the police on myself. Fear of abandonment, avoiding lots of things because of anxiety and fear, paranoia, and when super stressed, I sometimes get hallucinations and delusions, potentially full-blown psychosis. I also have flashbacks, nightmares, and dissociation, which are caused by the trauma that caused me to develop BPD. There's also the impulsivity, which is incredibly dangerous. The intense mood swings that seem unnatural to other people, so they call you an attention seeker, and the difficulties maintaining relationships. I think that's about the gist of it.